Hello, welcome to my video blog on professional counseling skills. I will be answering some questions based off this week's discussion post. The sessions were not what I imagined. After reading chapters 8 and 9, there's much more to therapy on the counselor's part than just sitting there and nodding their heads and saying, tell me more about that, or tell me how you feel about that. Simmons and his associates explained that a strong therapeutic alliance requires the counselor have characteristics like advanced empathy, which not only validates the client, but helps bring buried emotions to the surface. After watching both sessions, I realized advanced empathy helped the clients feel heard and understood, and I can see that advanced empathy is a very important skill to have as a counselor. From reading chapters 8 and 9, Simmons and his colleagues mentioned important core and advanced skills counselors must have to be effective in their relationships with their clients. Both counselors had nonverbal skills using the Egan and Reese's SOLAR acronym, meaning that they were squarely faced toward the client. They had open posture. They were leaning in, aiming their body and their voice toward the client, and most importantly, they were relaxed. They both used paraphrasing, reflection of feelings, and summarizing. In the session between Wayne and Stephanie, Wayne illustrated advanced empathy throughout the session. He simplified and brought to light the important points Stephanie made, like finding balance and feeling frustrated and overwhelmed. He then illustrated goal setting to work on ways to deal with frustration and her being overwhelmed in her work setting in the following session. In the session between Michael and Mariah, Michael used confrontation in one part where Mariah expressed how she does things that her boyfriend likes and not necessarily what she likes, just to have social interaction. Still, Michael approached her statement by reminding her of the goal she set to be more independent. Michael then worked with her on setting a goal and challenged her to invite two people to do something she wanted to do. So Michael used 3 skills: confrontation, challenging, and goal setting. The theoretical orientation of both counselors seemed to fit the Egan model, which illustrates a variety of skills like active listening, summarizing, and negotiating. Simmons and his associates explained that these skills assist in the process of answering 3 questions of the Egan model, which is, what is going on, what do I need and want, and how do I get what I need and want. Both counselors address these questions by identifying the needs of the client and setting goals to address the client's needs. Either counselor would be good. For me, they both worked with the clients on setting goals and identifying buried feelings. One question I would ask is, what strategies or techniques did they use to become better at recognizing buried feelings? I found in a study conducted by Arbergill and Tishby, published in 2021, that emotion recognition moderated a strong therapeutic alliance with clients. Treatment outcomes were more successful with counselors that had high emotion recognition skills compared to counselors with low. Being able to recognize buried feelings is a skill that I want to master as I gain competence in counseling. Thanks for listening to my video blog and have a blessed week.